Hello, 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 everyone. Hello. All right, guys. I think we are live today. Just waiting on for some more people to join. Let me see if I can lower this screen a little bit. I have some new followers. How's everyone doing today? This is my first time being live on Instagram. Thank you to those who are joining. All right. As we wait, hello, Evolution Heal. As we wait. Happy New Year, everybody. Happy New Year. Yes, we are live. It's the new year. We have some things going on. Super excited about that. So, yes, welcome to Health Tea with Dr. B. We are on episode 12 this week. Okay. So, this is the first episode of Health Tea with Dr. B. Okay. Now, does anyone here have a New Year's resolution? I know some people don't believe in them, but they're pretty decent. So, does anyone have a New Year's resolution? Well, my New Year's resolution is to be better and greater than last year. So last year was all about learning and growing. Now, this time it's all about action. Taking action about what I learned last year. All right. And so your New Year's resolution is to meditate 4 times per week. All right. It looks like we're good to go, right? I think we're good. All right. So all right. So now let's get it on. Remember, if you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, you are seeking treatment, the link is in my bio. You know you need that consultation. I know I have acquired a ton of new patients over the past 4 or 5 months, and I'm very happy for them because at the end of the day, they chose advocacy. All right. Also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram or Facebook or send me a message at bit.ly/health tea with Dr. B. Now let's move on to episode 12, Silent Signals, Understanding Thyroid's Secret Language. And as usual, I have some hot tea for all of you tonight. So let's get into the tea for the night. And hopefully you guys will be able to see this. So tonight I have hot toddy lemon ginger tea. So hopefully you guys can see this. Hot toddy lemon ginger tea. So that's what you guys saw me pouring earlier. Okay. So let's get into the benefits. All right. So the key ingredients are lemon and ginger and typically honey, along with hot water. All right. So why is this tea good for us? It helps to boost our immune system. It's soothing for cold and flu systems, and it can act as a digestive aid because we all know that ginger is renowned for its digestive benefits. So it can help to settle an empty stomach, or excuse me, an upset stomach, or reduce nausea and aid in digestion. So this is what makes hot toddy lemon ginger tea a good choice for after meals or if you're just feeling queasy. All right. It also has anti-inflammatory properties and hydration. So for my people who do not like to drink water, this is good for you because it does have a pretty good taste. Okay. Another benefit is relaxation and comfort, antioxidant benefits, and the honey that's within the tea is actually soothing for the throats. So let's do our taste test. And it's hot, really hot. You guys saw me pour it from my kettle earlier. Oh, and it's spicy. So it's temperature hot, which is good, but it's spicy because of the ginger. But it's actually pretty good. Like it's pretty good. So that's not bad at all. But it is spicy. So just beware. Okay. So remember, while hot toddy lemon ginger tea can provide these benefits, it is not a substitute for medical treatment. So if you're experiencing severe symptoms or illness, please proper diagnosis and treatment. Okay. And now on to our episode. Okay. So here's a disclaimer. The content provided in today's session is intended solely for informational purposes and should not be construed as direct medical advice. So, while I am aiming to share valuable insights and knowledge, it is important to remember that I am not your primary care provider. I wish I was, but I'm not. The information shared does not replace your doctor's medical advice, diagnosis, or treatment. If you do have specific health related questions or seeking treatment based on the topics discussed, you are encouraged to contact me directly at bit.ly/health tea with Dr. B, or you can consult with your primary care doctor for personalized medical advice. Your health and your well being are paramount, and getting advice tailored to your individual needs from a licensed healthcare professional is essential. All right, now on to episode 12, silent signals and understanding thyroid's secret language. So, who knew that this month was all about thyroid awareness? Thyroid is not discussed as much as I would like. So, if you didn't know that January is Thyroid Awareness Month, now you know. So, January is dedicated to raising awareness about thyroid health and focusing on the importance of early detection and treatment of thyroid diseases. The thyroid gland is a small butterfly shaped organ in the neck, right here, and it plays a critical role in regulating our metabolism, body temperature, energy, and just overall well being. So, here are some statistics. According to the American Thyroid Association, an estimated 20 million Americans have some form of thyroid disease, and up to 60% of those with thyroid disease are unaware of their condition. And women are 5 to 8 times more likely than men to have thyroid problems. Okay, so that's just a cool FYI. So let me tell you why I decided to discuss this topic for this evening. So over the past 6 months, I have been getting a ton of patients who are interested in weight loss. Weight loss, weight loss, weight loss. We always are hearing about Ozempic, Mounjaro, tirzepatide, semaglutide, and now Zepbound. And the problem is that a lot of the people who are coming to me, they are working out, but they all are complaining about the inability to lose weight, weight gain without even trying to gain weight, and just overall feeling sluggish and having brain fog. Okay. So when we do our deep dive in our weight loss program, I am now checking your thyroid. And guess what I'm finding? 99% of my patients have thyroid conditions and all different types, whether it is hypothyroidism, which we'll go into very shortly, or an autoimmune disorder, also known as Hashimoto's thyroiditis. So it is essential for us to know if you do have a thyroid condition, because now, if you want to lose weight, the only way now to be successful in your weight loss journey is to attack everything all at once. Okay? So now, what are the different types of thyroid issues? We have hypothyroidism, which is an underactive thyroid. And this is when your thyroid gland doesn't produce enough thyroid hormone. So think of it as a heater that's not working well enough to warm up your house. So this can make you feel cold, tired, cause weight gain, amongst other symptoms. Okay. And then we have hyperthyroidism, also known as an overactive thyroid. So this is opposite to hypothyroidism. This is when your thyroid is in overdrive and it makes too much thyroid hormone. So imagine a heater that's always on high. It can make you feel hot, sweaty, anxious, and you might lose weight without trying. True story, I have one patient who went from 150 pounds to 96, and it's really hard for her to gain weight. And then we have Hashimoto's thyroiditis. So this is an autoimmune condition where your body's defense system attacks your thyroid. So it's like having a security system in your home that mistakenly thinks that your heater is an intruder and it damages it, often leading to hypothyroidism over time. And now Graves' disease, which is also an disease, but in this case, the body's defense system causes the thyroid to overheat, leading it to hyperthyroidism. So now it is as if your security system was tricked into turning the heater up too high. Okay. Thyroid nodules. So these are lumps that are within the thyroid gland. Okay. So here, and most are harmless, like having pebbles in your shoe. They usually don't cause symptoms, but sometimes they can lead to hyperthyroidism if they start producing hormones or thyroid hormones of their own. So it gets really tricky. Okay. Having a goiter. Goiters are usually located here. And this is when the whole thyroid gland swells up, sort of like if the heater got really big, it was like so big that it was noticeable in the room. So a goiter can happen with hyperthyroidism, hypothyroidism, or even when the thyroid hormone levels are normal. So you can have a goiter no matter what. Now let's talk about thyroid cancer. So though less common, thyroid cancer is like a faulty wire in the heater that can be dangerous, and it can often be treated successfully, especially if caught early. And now here is one that people don't discuss as much, and it's called postpartum thyroiditis. So some women develop thyroid issues immediately after giving birth. It's like the body accidentally shifts the heater settings up and down temporarily. So it usually goes away on its own, but some women actually may develop lasting thyroid problems. I have one person whose child is 5 years old and she is still having the same issues. And then lastly, we have silent thyroiditis, which is similar to postpartum thyroiditis, but it's not related to childbirth. It's a temporary phase of overactive heating followed by a phase of underactivity. Then it usually settles down to normal. Okay. So I just listed 9 different types of thyroid issues. So each of these conditions have a significant impact on someone's well being, but with proper diagnosis and treatment, they can often be managed well. So if you suspect that you might have a thyroid issue, it's going to be important for you to listen to this particular podcast, but also talk to your healthcare provider who can test your thyroid and find the right treatment for you. Okay. But today we are going to focus in on hypothyroidism. So, what's hypothyroidism? So, imagine your body is like a car and the thyroid is like the gas pedal. So, hypothyroidism means that your gas pedal is stuck, it's not pushing down enough. So, your body's engine runs slow. This can make you feel really tired, making it hard to stay warm. It can even change your hair and your nails, and you might gain weight more easily and feel down at all times. So that's depression. So why don't people know that they have it? These things sound pretty common, but not a lot of people know that they have hypothyroidism. So a lot of people on a lot of different occasions, they don't realize they have this problem because the signs can be very vague. So for instance, if you're feeling extra tired or a bit cold, we always say that life is life, right? Or we say, oh, you might be anemic because you're also cold. Plus, since it happens very slowly, it can sneak up on you. And if you're not getting proper treatment, then unfortunately, you actually may not be able to catch it in time. It might be too late. So, how common is it? The T is that it's really common, especially in women. In fact, women are way more likely to have this low gas pedal issue more than men. It's not rare. Out of every 8 women, one will probably deal with it at some point in her life. Okay. So I'm speaking from experience. I never knew that I had a thyroid issue until I tested myself. So, what happens in your body when you have hypothyroidism? So, your brain talks to your thyroid, the gas pedal, with the special signals, right? When your body needs more energy, your brain sends a message to the thyroid to work harder. The thyroid uses stuff from your food like iodine that's also in salt to make its power up juice, which are the thyroid hormones. And so there are two main types. You have one that's ready to go, that's called T3, and one that's saved for later, and that's T4. So your body turns the saved up kind into ready to go kind when it needs a quicker energy boost. So, what makes treatment different for hypothyroidism? What does functional medicine do? Functional medicine is like a super detailed car mechanic. So, instead of just checking if the gas pedal works, it's going to check all the parts, the signals from the brain, the thyroid itself, and the energy juice levels. So, it doesn't just look at the usual tests that the doctors run, such as the TSH, but also at the other stuff, like the ready to go and the saved up thyroid hormones. And if the body's immune system is accidentally putting the brakes on the thyroid, okay? So by looking at everything, functional medicine tries to find out why the gas pedal is stuck and how to get it unstuck so you can feel better and zoom around again, okay? So what are some signs of hypothyroidism? So number one, we have fatigue. Everyone's always tired, right? And we always blame it on life. Weight gain and unintentional weight gain, headaches, migraines, thinning or dry hair with dry nails and skin, brittle nails. So, are your nails breaking? Okay. Feeling cold all the time and a decreased body temperature, having irregular periods. So, if your periods are every 40 days, every 3 months, you could possibly have a thyroid issue. Puffiness and fluid retention, that's also known as swelling, a slowed heart rate, fertility problems, low libido, so that's your sex drive, slow digestion and constipation, brain fog, depression. There's a ton. And when you have untreated hypothyroidism, here are the complications: elevated cholesterol, heart disease, high blood pressure, problems during pregnancy. So there's a ton. So it is essential and super important to get your thyroid checked, especially if you had any of the mentioned symptoms. Now, I want to do one even better. What are the symptoms of hyperthyroidism? So we have unintended weight loss, rapid heartbeat, increased appetite, anxiety and irritability, sweating, menstrual irregularities. And yes, you have every symptom, so you really need to get your thyroid checked. I think that's okay. That's MEK or MEK. But it's essential to get your thyroid checked because you can have it. And now here is an honorable mention: Hashimoto's thyroiditis. So I'm going to explain it to you all and then give you all a very scary story. So Hashimoto's thyroiditis is like your body's defense system getting its wires crossed and mistakenly thinking that your thyroid gland is the enemy. So it starts attacking it, which can make the thyroid slow down over time. So imagine your own body attacking itself. That is what Hashimoto's thyroiditis is. So imagine your thyroid as a worker in a factory that makes energy for your whole body. Now imagine if some of the other workers who are supposed to be guarding the factory start causing the trouble for the energy maker. This messes up the energy production line, leading to a less energy output. And that's what Hashimoto says, basically. So this makeup or mix-up can make you feel tired, you might gain weight, feel cold more often, and it's you just don't feel like yourself. And it's a pretty common problem, especially amongst women. And while it can be cured, it can't be cured, excuse me, it can be managed with the help of a doctor who might give you something like a supplement to help keep your energy levels where they should be. So what are the signs? You have gradual thyroid failure, right? You have a goiter, which is an enlarged neck of your thyroid, and a fluctuating thyroid function. So 1 minute you might be feeling like you are on drive, you're on go. And then 1 minute you might feel like you are on E, right? And so remember that this often progresses to hypothyroidism. So here's a quick story. A few years ago, I had an 18-year-old. come into the office, and she didn't have a period. She was missing her period literally like every 3 months. Every 3 months. And she thought that she was pregnant. She was sexually active, and she thought that every time that she would be sexually active, she would get her cycle. So she always thought it was pregnancy. So I asked her, I said, well, do you have any thyroid issues, or family history of thyroid issues? She says, yes, my mom has a thyroid issue, but that's about it. So we ended up checking her blood, and now what I'm looking for was PCOS, polycystic ovarian syndrome. That's what I'm looking for. And I was so surprised to find out that she did not have PCOS. She was actually in early stages of ovarian failure, a teenager, which means that she was in forced menopause. And why? Because she had uncontrolled Hashimoto's. So this changed the game for me because she is only a teenager. She doesn't even know if she doesn't want to have kids yet. But all we know is that she has Hashimoto's. And now, because her Hashimoto's is uncontrolled, it is forcing her body to go into premature ovarian failure, going into menopause. So even if she gets one later, she can't unless she gets her thyroid treated. So this is how serious it is. Honestly, this is how serious it is. So this is why there is a month for thyroid awareness, even though I acknowledge it every month. But you really do have to get your thyroid checked, okay? Because we just never know. So what is the T on the common causes of hypothyroidism? So again, we have the autoimmunity, which is Hashimoto's, right? So imagine your body's defense system mistaking your thyroid for the invader and attacking it. So again, this is the most common in women, and it can slowly damage the thyroid, which will now open the door for hypothyroidism. Another cause is iodine deficiency. So your thyroid needs iodine in order to function and to make hormones. So when you do not have enough iodine, your factory slows down. Where can you get iodine from? Seafood, seaweed, iodized salt that they always tell us to stay away from. But you really do need salt. It just depends on how much salt in your diet. Having too much iodine is also a cause. So when you have too much iodine, it can also jam the system. It can jam the factory, especially if you already have thyroid issues. And now let's think about environmental factors. Certain things we just can't avoid, like heavy metals or chemicals in our surroundings. So when we are in bad environments or the duct systems aren't clear, it can throw off our system. It can throw off our factory. So it's like throwing sand into a machine. When you throw sand into a machine, it kind of starts grinding. That is what happens. Okay. Um, Postpartum thyroiditis. So as I explained earlier, after having a baby, some women's thyroid they get inflamed, first going into overdrive, and then it slows down. And now let's think about our people who do chronic dieting and excessive exercise. Sticking to a very low calorie diet or overdoing exercise can definitely stress your body, causing your thyroid to slow down as a response. Okay. Think about hyperthyroidism treatment. So when we get treatment for certain conditions, it can actually cause our bodies to shut down and go into hypothyroidism. So it's like we're putting a kink into the hose. Or if you know someone who's had thyroid surgery, also known as a thyroidectomy, um, when you have your thyroid removed or damaged, it will not produce enough hormones, which means that your door to getting treatment will be permanent. You will have hypothyroidism if it's not treated. Okay. So, what are some functional medicine approaches to testing? So, when people come into my office, I let them know straight up that I am a functional medicine provider, which means that I don't practice mainstream medicine at all because mainstream medicine doesn't get us to where we need to be. So, think of your thyroid as a factory. In your body, there's a little factory, such as the thyroid, that makes stuff like hormones, which can help your body run smoothly. like energy, temperature, and mood. And functional medicine is a detective. So instead of just checking if the factory's main door is locked, just like the TSA, functional medicine is going to check all of the doors, the windows, and even the quality of the stuff that's being made. Okay. So why is comprehensive testing so important? It's because your TSH levels can be within normal ranges even when a person is symptomatic. So, who has gone to the doctor and said, "Hey, I feel tired, I feel sluggish," but they always say, "Oh, you're normal, you're just fine." Very common. So, full thyroid function involves multiple hormones and antibodies. So, here are the tests that we use. We do a complete thyroid panel, and this is like checking all of the different parts of the factories to see if it's working right. So, it usually includes the usual stuff plus more, like T3 and T4, which are the main products of the factory. So, free T3, which measures the active thyroid hormone available to the body tissues. The reverse T3. So, imagine this is as a fake product that can mess up the works if there's too much of it. So, the reverse T3, if there's too much of it, it's going to cause an issue. That's why we check it. The thyroid antibodies. These are like the factory inspectors. If they're always there, it could mean that your body is mistakenly trying to shut down the factory, also known as Hashimoto's disease. The thyroid globulin antibodies, which helps to diagnose Hashimoto's or thyroid cancer, and the thyroid peroxidase antibodies, also known as TPO. They are often elevated in Hashimoto's thyroiditis and can indicate the presence of an autoimmune thyroid disorder. Okay. And so, what about testing your nutrients? We don't only just check your thyroid. Now I'm doing a nutrient check. So, me being the detective, I'm checking to see if the factory has all it needs to work well, like your vitamins and your minerals. Okay. It's like making sure that there's enough plastic and metal if you're making cars. So that means I'm checking your iron, I'm checking your ferritin, I am checking your vitamin D, your vitamin B12, and folate. Okay. And now, what about your gut? What about your gut? This is like looking at the cafeteria and the restrooms in the factory. And if they are a mess, it can cause problems for the entire operation. So, with the gut test, we are checking to see if for things like bad bacteria and inflammation. With food sensitivities, imagine that the workers at the factory are allergic to certain foods. If they eat them, they get sick, and that can cause trouble in the factory. So they test to see what foods might be causing the issues. So, is it dairy? Is it gluten? Is it wheat? So there's a number of things, right? So now, what's the key to treating hypothyroidism? So it's more than just medication, even though sometimes medication will not, you can't avoid certain things. So, unlike traditional treatments that mainly give you hormone pills, like filling a car with gas but not fixing a leak, functional medicine, we try to fix the root problems that's causing you to be sluggish. So, many providers or mainstream focus solely on levothyroxine and synthroid, right? But my personal health tea or drug of choice is NDT, which is non-desiccated thyroid. That is my drug of choice whenever I'm treating a hypothyroidism issue or even Hashimoto's. Believe it or not, now here's some tea that's not too good, but I will share it. But a lot of mainstream, they don't believe in treating Hashimoto's. So think about that. So, how else could you treat hypothyroidism? Personalized diet, of course. This is like customizing the fuel for your car. It involves eating anti inflammatory foods. So, think fresh and unprocessed food, and avoiding the foods that might irritate your body, like gluten, dairy, processed sugars. So, now, The goal is to calm down any immune system overreaction that may be affecting your thyroid. We also need to balance nutrients. So it's like making sure your car has all the right oils and fluids, not just gas. So again, if we're going to balance the nutrients, I need to supplement you now with the nutrients that you're missing. Okay. But we have to be careful with iodine because causing or giving you too much iodine can cause you to have an issue, which will backfire. Okay. That's why you always should have a medical professional on deck. So, fixing gut health. Imagine your gut as a garden that needs good bacteria, like healthy soil. So, eating a variety of whole foods and foods rich in natural probiotics, like kimchi, helps keep this garden balanced. So, a healthy gut means less inflammation, means a happier thyroid. I know, easier said than done. Easier said than done. And now, stress and sleep. This is an issue with everyone. High stress is like constantly revving the car's engine. After a while, your thyroid is just going to go kaput, and so are your adrenals. So managing stress and getting good sleep helps the thyroid, and the rest of you work better because everything has to be harmonious. Okay, so gentle exercise. So rather than those intense workouts, I suggest yoga, walking, because it's like a gentle drive instead of a high speed chase, helping to reduce the inflammation. So you kind of have to work up your body to all of these things. And then nature time. Go outside, get some sunlight, connect with nature, do some grounding. Try to help balance your body because when you balance your body, you help to balance your thyroid. All right. And now there are supplements like ashwagandha, which has been shown to help with thyroid balance. So, what it does is ashwagandha helps your body deal with stress and inflammation, and it's also been found to help with energy, muscle strength, and sleep. And it can also improve your thyroid hormone. So usually the typical dose is about 600 milligrams once a day for about 8 weeks. Okay. Vitamin D, which is important for people who have thyroid issues, because we usually don't have enough vitamin D in our system. So the amounts can definitely vary between 2,000 to 5,000 international units daily. I would suggest taking it daily for at least 12 weeks, and then you can have your provider check in, right? And then thyroid synergy. It's one of my favorites. So it's like a multivitamin made especially for your thyroid. It has a bunch of ingredients like vitamins A, D, iodine, zinc, selenium, and more. And these are all the nutrients that your thyroid needs in order to make its hormones. So it includes other things like American ginseng and proscolin, which helps your body deal with stress, and it encourages your thyroid to work properly. So, how much and how long? You can take it like 2 capsules a day for at least 8 weeks. All right. And then avoiding the bad stuff in general. So, reducing exposure to chemicals found in plastics and pesticides. It's like keeping your car away from bad roads or polluted areas. So, this can involve using filters or cleaner water and air and choosing more organic foods. Okay. So, basically, functional medicine for hypothyroidism is like a full service tune up for your body and not just refilling the one that's low. Don't you hate when you go to a store and they just do the bare minimum? That's what mainstream is. We want to do functional because it looks at everything from a diet and gut health perspective to your lifestyle, to your environment, to get your thyroid into you back to feeling good. Okay. So that is all really with thyroid issues. Um, Again, January is Thyroid Awareness Month, which means that it's going to be super important for you to get your thyroid checked. Because if you had any of the mentioned symptoms, I'm sure your thyroid is out of whack. Okay. And if it's not out of whack, you might have something else. So it's going to be super important for you to take care of yourself. So here is my New Year's resolution for you. My goal and my hope for you. and for whoever is watching, my goal now for you is to make sure that you are properly educated, that you are advocating for your health. Because if something doesn't feel right, then it's not right. If you are not doing any treatments or on any supplements, then something is not right. Okay. So it's super important. It is super important for you to take care of yourself. So that is my New Year's resolution for you. Like I said, and it's very similar to mine. Like I said, last year was all about learning and growing from that learning. This year, it is all about acting on it. So now it's time to be a woman of my word and practice what I preach, right? Okay. So thank you. And that is all for Health Tea with Dr. B. Again, I always want to thank you all for joining Health Tea with Dr. B. We are on episode 12, the first episode of the year. I'm super excited because our next session is going to be mind blowing. It is something that's very dear and near to my heart. I hope you guys will definitely enjoy that one. I hope you guys enjoy all of them. Okay. I'm super, knowledgeable about a lot of things and I'm easygoing. So if you guys ever had a question, just send me a message. Send me a message on bit.ly / health tea with Dr. B. That's all you have to do. Okay. And don't forget to share this with any of your family or friends. We are on Facebook, we are on YouTube, and now guess what? I know how to do Instagram, guys. So I'm excited. I am excited because it took a long time for me to learn how to do this, you guys. I worked really hard. Okay. Well, I want you all to enjoy the rest of your evening. I will see you all in 2 weeks, okay, with some good tea on another topic. And I'm going to continue to enjoy this, what is it, hot toddy? Because it was pretty good. It actually was good. It's just spicy as heck. So just be careful. All right, guys, I want you all to take care. Have a good evening and stay safe. Bye.